Sherman.
Deputy Speaker, I shall rattle through my speech. I always like to speak in the Queen's speech. I thought I was being robbed this time, but here we are back with the opportunity. I'm not an expert on health, but I do take a great interest in it. I do have some real interest in management, and so I want to say something about the big issues in the health. We have a brilliant National Health Service. We will all politically keep on fighting about it, but I agree with the Right Honourable Gentleman, the Member of Penrith and the Board, that at some stage we're going to have a Royal Commission, especially on social care. It is going to be so expensive as people live longer and we have more challenges to provide a decent care for people. And of course, everyone loves the National Health Service, but not many people actually want to pay much more in their taxation. So we've got to find out, we've got to crack the funding of the National Health Service properly, and partly that's because of the implications of social care, but also the fact that we're getting cleverer all the time. You know, I had the pleasure of having a breakfast meeting with Professor Topol, you know, and that very innovative paper that he wrote for the government in terms of, you know, new technology, new science, new ability to identify cancers and diagnose earlier. All that is so exciting, and it's going to happen. It's going to cost money, but I believe where we are severely deficient in our health service is the quality of management. I spent some time in hospital a couple of years ago, not on something very serious, but I had the ability to look at how a hospital is run. And the more I look at it, the more I realise that people are not really trained properly in the health service. Doctors don't get trained as managers. We often promote very highly skilled medical people to manage our health service. There is no great institution, you know, providing education for the best administrators and managers in the health service. They have it in some parts of the United States and other countries, France, but we don't have that very high quality management. We need to look at that because the future needs very high quality people. On the other hand, can I just make a slightly discordant? The thing that causes ill health is poverty. The relationship, we all know it. Know it in my constituency, we know it everywhere. Poverty, poorer people get ill. That's a fact of the matter, and austerity in the last few years has made a lot of people ill, and I wouldn't detract from that. What are the indicators of poverty and ill health? One of the things I notice is dentistry. In this country, you've got to be really, really poor to get any free dentistry. There are very few in my constituency, National Health Service dentistry, and we're beginning to see people with awful-looking teeth. You know, and it is. You need wealth these days to be able to afford good dentistry. That is a dreadful, dreadful thing that we push dentistry out of the National Health Service, and it's not acceptable to so many people. On the other hand, I believe that there are some really exciting signs that we now need a new model of hospital. We need a new model of GP surgery, and some of the very best that I visit are top class. I think in terms of hospital, we've learned that big hospitals are no longer the most appropriate for most communities. I'm delighted. After a massive campaign in Huddersfield, we've got money for a new A&E service in our old hospital that Harold Wilson opened. But it is out of date. We need a new build. And I would offer the Secretary of State and the ministerial team today, we would build on a wonderful site, that Harold Wilson site, a modern, techie, innovative, wonderful hospital. We've already got some money for the A&E. We could go the thought further and build a modern, a futurist and a wonderful hospital. I've done a lot in public health. I organised the seatbelt legislation and banned children from being carried unrestrained in cars. It's one of the things I do with the World Health Organization internationally. You know, 1,780 people get killed every year. 10 times that number get seriously injured. The impact on our hospitals is massive. But also, we need much better health. Where has health education gone? People say public health, and they turn it off. Local authorities haven't got the money to deliver it. Public health education, obesity, drug, as the Honourable Lady earlier said, drug addiction, alcohol addiction, smoking. We could make such changes if we had more relevant education, public education on these matters. Madam Madam Deputy Speaker, they're the things that I think that we should be doing something. Atrial fibrillation, half the people in the country don't know they've got an irregular pulse. If they have one, they're going to get a stroke. All sorts of things like that we could do in this wonderful health service. We just need the time and resources.
Sir Mike Penny.
Thank you very much, Madam Deputy Speaker, and it's a pleasure to follow the Honourable Member for Huddersfield. And on many of the points he raised, I completely agree with him, and I think everybody across this House would agree. I'm not confrontational usually, politically, so I'll only do a tiny little bit. This fear thing that's being thrown out about the privatisation of the NHS is very damaging, and it's not particularly damaging to this party, but it's damaging across politics that's damaged. I was at that dispatch box for 4.5 years, Madam Deputy Speaker, as the Shadow Health Minister. All the PFIs that went through while I stood at that dispatch box, where private companies were getting paid for surgery they weren't even doing. They were contracted for 1,000 knee ops or 1,000 hip replacements, and they weren't doing them, and they were still paid for that. That was under the previous Labour administration. And what we need to do is admit we make mistakes when we're in government. We've made mistakes before. I made mistakes as a minister when I was in 7 different departments. Probably not 8 now. And of course, when governments are in, for the best of reasons sometimes, they make mistakes. And one of the great mistakes was that privatisation era, PFI, off-balance sheets, Darcy clinics, all that sort of thing, probably done for the best of things. Lord Darcy was a great surgeon, a great medical man. Just happened to completely disagree with a lot of the things he proposed when the government took his ideas forward, and frankly they haven't worked. And there's still a lot of these clinics out there now where trusts have to pay them huge amounts of money, not to get out their contract, just to actually carry on. And that's something we need to admit. So in this House, let's admit governments make mistakes. The PFI, the privatisation that the Labour Party did was wrong. Probably done for the best of reasons, wrong. A PFI hospital was promised to my constituents. It never came, even though the Labour Party closed the A&E at Hemel Hempstead Hospital, the largest town in Hertfordshire, that was promised that would be looked after because St Albans had had theirs closed and Hemel was there, and it was closed, and the whole thing moved to a Victorian hospital in the middle of Watford, which can't cope today and hasn't been able to cope since then. Adding little bits to hospitals, as the Honourable Member for Huddersfield has said, and putting a new A&E on the front, sometimes can work. But when there is serious funding around, which is what we're talking about at the moment, actually a modern, new, environmentally proper hospital that can actually have the footfall through so that the medics can have that specialities is what we actually need. So I'm one of the few Conservative MPs that's been offered the £400 million for a new hospital, and I've said to the Secretary of State and to my trust, it's not a new hospital. It's a refurbishment of a Victorian hospital in the middle of Watford next to a football ground. And my community do not want that. People of Watford might, but if they thought out of the box, and it's not being rude to them, wouldn't it be better to have a brand spanking new hospital that looks after the communities of Watford and the surrounding areas, Hemel Hempstead and surrounding, St Albans, in that massive growing area just north of the M25. So I don't want my hospital reopened. It is still sitting there boarded up, Madam Deputy Speaker. It's just sitting there like a running sore in my constituency as to what this wonderful new hospital was when the new town was built. And there she sits with 2 wards and some outpatient facilities. A miser in the region, it doesn't even open, bear with me a second, for 24 hours, even though we was promised it would. What we want is a tiny bit more money, and the Secretary of State knows this, so I'm not saying anything to the Minister that he doesn't know. And actually, don't keep frightening people by saying it will cost £750 million or £1 billion to build the new acute hospital on a greenfield site, because we know it won't. We've got the experts working for the new hospital action group. I'm going to meet with the experts in the department in the next couple of days. So I'm actually saying to the department, hold back for a second on this new hospital for us, because actually if you hold back a second, we might get a completely different result. I'll give way to the Honourable Chair.
I'm grateful to the Honourable Member for giving way, and he's speaking very candidly and with great integrity, I think. In fact, my mother died in the Hemel Hempstead Hospital that he speaks of many years ago. But when he talks about PFI, and I think some of the remarks that he's made are absolutely spot on. But when he talks about PFI, does he now recognise that actually the money that is owed on those PFI liabilities is actually 9 billion as opposed to the 11 billion, which is the backlog of what hospitals are paying to the department itself because of the borrowings they've had to take out because of the problems, the financial problems they're facing?
We were saying with the spokesman for the Scottish National Party earlier on, government can borrow money much, much cheaper than any private organisation, and they can guarantee it in a way. I'm thrilled, actually, that there's some honesty in this chamber, because we've argued about the PFI for donkey's years. It was a way of getting it off balance sheet. Let's move on from that. There's no more PFI. We can all agree. But actually, we're not privatising the NHS, and everybody with an ounce of common sense knows that. The NHS is perfectly safe. It's been safe under this party for the majority of the time it's been in inception, and it will stay perfectly safe. But there are massive demands on it. Massive demands on it. And one thing I cannot allow to happen is that all this money, taxpayers' money, is going to be put into a Victorian hospital next to a football stadium in the middle of Watford. And anybody that knows our part of the world, Watford is in the Premiership. It might be struggling a little bit at the moment. They did very well against the Spurs the other evening. But let's pause, get the experts around the table, stop scaring people with costs which are completely unrealistic. New hospitals were built in Birmingham for 425, a new one almost certainly going to be built in Harlow for the similar sort of money, and have a 21st century hospital. And let's actually be honest with each other and move that forward. Thank you, Madam Deputy Speaker.
Brendan